Bowel and GI symptoms in endometriosis. What are the treatments for it? Let's talk about it. So always the gold standard treatment for endometriosis is removal of disease through deep excision surgery performed by a skilled, well-trained, fellowship-trained surgeon. Somebody who really understands the complex disease of endometriosis. So that's where you start. You don't need to start there, however. Just let me say that. If you don't want to do surgery, you go, girl. Don't do it. But now your next options are medications. So typically what they prescribe is either opioids for something like this, for bowel GI symptoms. They're going to do opioids, which is funny to me that that's what this is just me, this is just my opinion. It's just funny to me that that would be the prescription. That would be the treatment. Because opioids are known to cause some of the exact same symptoms that they would be trying to treat for you with that. Just making it worse and causing you other problems. Anyway, next up would be hormonal medications. Now, what this does is it turns down the volume of the symptoms and pain that you experience. For some people, it doesn't work for everybody. And if you're curious as to why, I know I mentioned it recently, but it's got to do with prostaglandins and estrogen and endos complex. Anyways, so hormonal meds. So that would be either like a hormonal birth control, or it would be like a GnRH, which, if you know me, you know, I personally believe if you're going to be doing hormonal medication, this is just, again, my opinion. I'm not a doctor. I'm not prescribing or advising anything to you personally. Go and talk to your own doctor about this. But GnRH medications have not been proven to work any better than hormonal birth control, which is way more affordable and doesn't have super scary side effects like GnRH. Anyways, the hormonal medications, what is that going to do? That is going to turn down the volume of symptoms. It is not going to stop the progression of disease, which can be scary in this situation when dealing with GI and bowel symptoms. And the reason is because things like bowel obstruction can happen because silly little diseased endometriosis lesions will continue to grow and just cause a whole bunch of fucking problems. What have I found works? All right, what you need to know is at 5 years old, I started cutting my underwear because I was bloating so severely with what I now call endo belly, right? And I also had extreme nausea and vomiting at a very young age. So vomiting wasn't as bad, but really bad nausea. And nausea has been my worst, like, everyday symptom issue that I have to fight and manage every day of my life since I was 5 years old. I am not kidding. So, I have found that a multidisciplinary approach is best. Surgery, I don't do medication. So I guess I just lied. Diet and lifestyle and physical therapy. That's had the biggest impact for me.